Understanding human search intent means understanding the main motivation and the queries that people have in mind as they type your keyword. And it's also about understanding their headspace in that specific moment as they type. Are they worried? Are they anxious? Are they skeptical or completely confused? And this is absolutely key in SEO health writing. Here are some good questions to ask yourself before writing. For example, what are the main pain points, concerns, misconceptions around the topic your audience is having as they type their keyword? Which kind of information exactly are they looking for? Do they want to hear from other patients? Do they want to hear from a healthcare professional? Do they want to see evidence from the science? Or do they want a step-by-step guide or a list of actionable tips? What do they want? Do they need me to explain their disease or symptoms? Or do they already know all this and they're simply looking for what their treatment options are? In other words, you can write very well, but if you miss analyzing this intent, then your blog might not be helpful at all. And we can apply exactly the same concept to AI searches as well. As a matter of fact, AI is not so good at doing this exercise as it's lacking empathy, so you really need to ask yourself the right questions before you start. And let me give you an example of what could be a real story behind a search. What made Rob open Google after 10 p.m. at night on a Tuesday to type magnesium side effects, or what are the side effects of magnesium? So many writers would just start diving right in by explaining the science accurately. And fair enough, that's what we do and we want to know as scientists. But Rob isn't just looking for facts or medical data. He's probably staring at a bottle of magnesium he picked up earlier, and now he's wondering if the cramping he's feeling is just normal, or if he made a mistake and took too much magnesium. Or worse, it could be the bottle was full earlier, and now it's empty because he left it on the kitchen table, and he simply forgot to put it away, and now he's thinking about his toddler. And as you can imagine, the guilt is just killing him. Rob, in that moment, is terrified. He's very unlikely to listen to your scientific facts in that state, don't you think? And likewise, in some cases, I noticed that patients only want to hear stories from other patients who went through exactly the same struggles. They don't care so much about the science. And it's our job to find out what they need in that moment. And there is data actually showing that when people search for information online for help, it can be the actual source of added anxiety for them as they see too much information, for example. So this is what we want to address here in our blogs.